Well, the emergency departments at Leeds General Infirmary and St James's University Hospital have seen unprecedented numbers of patients seeing us this year than any previous year, amounting to hundreds of patients every week. We're seeing a large numbers of patients who really do need our services, acutely ill or injured patients, but we're also seeing large numbers of patients who really don't need to be here, who don't need the services that an emergency department can provide, that could really have accessed other services more effectively and more efficiently than just turning up to an emergency department. There's a whole range of services that people can access to meet their needs. So, for example, we're not experts on long-standing skin rashes, but patients often come to us with a long-standing skin rash asking for our opinion. We would be really keen to reinforce the message that self-care, contacting 111, contacting your pharmacist, speaking to your GP are all options to be considered before coming to the emergency department. If you can get your care elsewhere, please do so. A lot of the time patients come to us really for convenience. They've not been able to see their GP or get an appointment for their GP, or they've not tried, or we just happen to be local. So a good example is a lady who brought a child who was very well with some diarrhea, but also decided to book in his brother who had had a cold for a few days because she wanted him to be checked over. Now, I think it's pretty self-evident that those children didn't really need to be in the emergency department, but we had to look after them because they'd booked in, and we have a duty of care to see anybody who attends. We're anticipating a really difficult weekend. We've done as much as we can do with the resources that we have available, and we know that we provide an excellent level of care for the people who really need our services. But sometimes it can be delayed, and it's delayed because of the number of patients who could be managed elsewhere, who we just have to see before it becomes evident that in fact they could have their care elsewhere.